Hi, this is Dr. Sandy, and I would like to explain to you the procedures that we offer in weight loss and metabolic surgery. So basically, we have two options, that is a restrictive procedure or a malabsorptive procedure. A restrictive procedure would be the gastric sleeve. This is the most common procedure worldwide. And here what we are doing is we are creating a smaller stomach so we can have less calorie intake. As well, the part of the stomach that we remove is the fundus, where we produce a hormone that is called ghrelin. And this hormone gives us preferences for certain foods and as well controls hunger. So we can see from day one after surgery that we do not experience hunger anymore. As well, we have a malabsorptive procedure that the most common would be gastric bypass. And here we are creating a smaller stomach that would now be called a pouch. And then we skip a part of the bowel that will not have contact anymore with liquids or foods. And this is why we experience the weight loss. This is why it's called a malabsorptive procedure, because we are absorbing less of what we are drinking and eating. It's important that we know that in this procedure, we do not experience restriction. And this is a very common complaint after surgery, where patients refer that they do not feel full. And it's important that we have this correct information before having surgery. And then we have a combination of these two types of procedures that would be the duodenal switch or the SADI procedure. And here we are combining a restrictive procedure with a malabsorptive procedure. We are doing a gastric sleeve, and then in the first part of the bowel, that would be the duodenum, we are connecting the inner part of the bowel. So here we can skip a large part of the bowel, and we have more malabsorption. We have the combination with restriction, and this is what gives us the better results long term. We can see more weight loss, and as well, we can control or we can completely have resolution of chronic diseases like diabetes and hypertension. So it's important that we have all the information that we need before we take an informed decision. Any questions that you have, please send us a message.